to the Chiefs.
Magandang gabi po. Good
Magandang
evening
gabi po.
to everyone.
Opo. Well, sir, ito nga po, napag-usapan namin kagabi with the Private Hospitals Association. Ang sabi nila, mukhang nahihirapan sila dun sa sources silang short sa mga nurse. At the same time, ang understanding namin, maraming nurse na walang kabuhayan ngayon, naghahanap silang trabaho. So, paano, how do we reconcile po yung mukhang dalawang magkaibang naratibo?
Oo, totoo po yun. Matagal na po talagang understaff ang ating mga hospitals. No? Ang problem po kasi is hindi nakikita ng iba nating mga kasamahan, ng iba nating mga nurses, yung pagpapahalaga na ibinibigay ng gobyerno sa amin, no? sa aming mga nurses. No? With regards to salary and benefits, no? Kaya naman mas pinipili nila na magtrabaho sa ibang larangan na hindi wala doon sa field ng nursing. Marami tayong mga nurses na nasa call centers. Marami tayong nurses na nasa Department of Education, no? Not as school nurse but as teachers. Marami sa Philippine National Police, sa Bureau of Fire and elsewhere. No, so yan po yung reason kung bakit mas nararamdaman talaga natin yung problema ng understaffing sa hospitals.
Pero ang pagkakaunawa po namin ay maraming naghahanap ng trabaho sa mga ospital pero walang nag-hire, or at least yung gobyerno hindi nag-hire, no? Kontra sa sinasabi nila na nag-o-open daw sila ng mga vacancies for X number of nurses. I forget the figure, no? Pero na merong ganon. Totoo ba yun na walang nag-a-apply?
Ay, hindi po kami naniniwala na walang nag-a-apply kasi sa dami po ng ating mga nurses sa Pilipinas, no, hindi po kasi kami naniniwala na may shortage ang ating bilang, no. Katulad ng sinabi ko sa inyo, marami tayong mga nurses na nasa ibang larangan na gusto nang bumalik sa hospital upang makatulong sa Pilipinas. No, hindi po kami naniniwala na walang nag-a-apply na nurses kasi maraming gusto na makatulong, maraming gustong bumalik sa nursing, no, na magsilbi sa bayan. But then kasi ang ino-offer ng government natin at times is job orders, contractual. So siguro yun po ang tingnan natin na baka hindi ka nais-nais para sa ating mga nurse ng ganung offer, no, na kabila ng mga kaya at pwedeng gawin ng ating nurses na makatulong sa sitwasyon ngayon, yung pagpapahalaga ba na nakikita nila na
pero sa private hospitals daw, hindi raw mga contractual Talagang hinahanap daw nila, bagamat mas mababa ang sweldo, regular employment, no, with benefits. Pero wala nga raw takers In fact, ang dami raw nag-furlough, nag-resign, at yun nga. So, parang hindi yan tugma sa sinasabi nyo.
May mga reports din kami natatanggap na wala raw nag-a-apply. At minsan naman yung movement, no, like for example, may mga hospitals na nag-o-offer ng permanent, like sa Pasig, yung Rizal Medical Center. Maraming nurses na coming from the different parts of Rizal are applying to Rizal Medical Center because yung ino-offer nila ay permanent position. No, so dun sa mga nag-o-offer ng job orders and contractuals, wala talagang takers. No, yun talaga yung nare-receive naming report. Pero dun sa private hospitals kasi, because of the discrepancy nga ng salary, nahihirapan din tanggapin ng nurses. Yung bang parang every day your life is at risk, tapos yung bang makukuha mo would be worthy ba? No, nung yung ipapasok mo dun sa hospital. So ganun po yung mga considerations. There are personal reasons and siyempre, we understand naman our nurses.
So mababa ang salary talaga yung main driver, ano? Kasi even before the pandemic, kinikwento na yan sa amin ng Nurses Association Talagang mababa daw sweldo, lalo na nga sa private sector. And kahit yung sa government, nabababaan pa rin actually kaya nga nagtatrabaho sa labas Pero apart from that, meron bang pag-aalangan na natatakot na kasi sinabi din to sa amin, at the start of the pandemic, natatakot naman daw ibang nurses na ma-assign sa COVID ward. Nandun pa rin ba yung pangambang yon? Saka mababawasan ba yon kung sakasakaling meron ng vaccination in earnest na maipapangako sa inyo?
Palagay ko po mababawasan yung takot kapag alam ng ating mga nurses na protected sila. May mga factor lang po na ikino-consider kasi there are times na yung nurses natin ay ina-assign doon sa COVID ward or ICU ward na hindi naman nila gamay, hindi sila sanay, no, hindi sila handa. So ganun po siguro yung nagiging factors kung bakit mas pinipili ng nurse na umayaw or mag-resign because yung kahandaan ay hindi nila nararamdaman na kakayanin nila. Ang problema po kasi because of understaffing at kulang talaga ang mga nurses, hindi naman din natin masisisi ang mga hospitals na magkaroon ng ganong circumstances na kailangan nila mag-cope, no, dun sa demand na kailangan ng hospitals para po dito sa problema natin yun.
Sir, yung po bang yung dami ng nurses natin relative to the limited openings, has that existed for a long time? Parati bang ganyan yung sitwasyon? I ask also because about a decade ago, yun talaga yung konteksto, di ba? Biglang nag-boom yung nursing schools, and that also coincided with a surge in demand also for nurses from Europe, from the UK in particular, to Canada and the United States. Ano po ba to? Itong nakaraang dekada na to kung kailan biglang dumami yung nurses, does this stand out as a period in terms of the number of nurses that we produce?
I think so kasi marami pa rin tayong mga nurses na talagang nakakapagtrabaho sa ibang field at maraming nagnanais na mag-abroad. So yung numbers are still good siguro. Maraming mga nag-aaral tungkol sa number ng nurses and they do not believe that we have shortage. Meron tayong maldistribution. Yung nursing moratorium and yung mga pronouncement from the government agencies na yung hindi nila din ini-encourage yung pagkuha ng nursing. Naka-apekto po yun, mga 5 years po siguro na medyo mababa po yung enrollees ng nursing. No? Kaya siguro po naging factor din yan.
Sir, baka you can zoom out and give us a bigger picture of the situation. I don't know if you have data, pero for example, how many nurses are we talking about in the Philippines? How many nurses, first in general, in the Philippines versus how many are looking for a job na nurses na?
Ng PRC po, ang registered nurses ay about 600 to 800 if I'm not mistaken. 600 to 800,000.
Okay.
But hindi po kasi natin alam doon kung sino yung nasa abroad, ilan doon yung nasa abroad, ilan na yung namatay, no, ilan na yung nabawas sa list. So, yun po yung ginagawang paraan ngayon ng Board of Nursing na i-account yung nursing workforce natin sa Pilipinas. Ano po?
Pero sir,
hopefully po.
Yes, sir. I understand, sir. Pero sir, at the very least, would you have any idea kung ilang libo yung nurses, registered nurses na walang trabaho ngayon? If you have lang any idea, any numbers?
Ay hindi ko po masasabi na I do not know the exact data pero hindi po ang problema is yung walang trabaho sa hospital. So, yun po ang sigurado kami. Marami pong nurses ang wala sa hospital, nagtatrabaho sa ibang agencies.
Okay, so sa punto, sa tingin mo ba kung mag-alok ang gobyerno, ang mga pribadong ospital na naghahanap ka, sa tingin mo ba lilipat sila ulit sa hospital work? Nag-improve na ba yung, sabihin na natin, yung benefits, lalo na kung COVID-related? Kasi nung nag-umpisa pa lang yung COVID, quarantine nila nasa tent, halimbawa, hindi sa loob ng hospital. Wala na siguro ng mga ganon, ano? Siguro naman ngayon mas maganda na ang facilities ng mga nurse. Do you think that there are enough nurses who will actually fill up the slot?
Yung kayang ibigay ng gobyerno ay magiging parang kanais na. Sigurado po, meron pong babalik, no? Meron pong magpipil doon sa kulang. Mga nurses natin ay talaga namang, di ba, hinasayan sila upang maglingkod sa bayan. So alam po namin na pagkakinailangan sila, tutugon po sila doon sa pangangailangan ng bansa. But then, tulad po ng sinabi ko, para po sa gobyerno, sana po makita nyo na dapat naman ibigay sa kanila kung ano yung dapat para sa kanila. Para naman po,
ano naman starting? Anong starting salary? Para lang alam natin ang pinag-uusapan. 32,000 ba yan? Or,
starting salary po ay salary grade 15.
For public?
Yes, Ma'am Lucy, salary grade 15 po yung nasa batas na for public nurses, for government nurses only. No, that is amount to 33,000, I think, no?
Yes,
Or less.
33.
So,
Okay.
but the problem is, hindi po siya na-i-implement ng maayos. Opo. In
What do
government.
you
Tapos
mean by
nagkakaroon
that?
ng discrepancy with the private. Siyempre, yung 33,
Oh,
there are kasi po mga job orders pa rin talaga na kailangan tingnan ng government eh. May mga nurses
okay.
po tayo na under orders and contractuals na wala po silang benefits talaga. So, kahit po starting salary, salary grade 15, hindi rin po na ibibigay sa mga nurses natin.
Yung sa private sector po, how does that compare sa private sector?
Sector po ay yung malalaking halos kapantay po noong na sweldo sa gobyerno, hindi man siya kapantay pero malapit, nagagawa po yun ng mga malalaking hospital. Pero salary. So nahihirapan po silang mag-cope with that. But because of the development ng salary grade 15, ngayon taon lang po yan, noong 2019, 2020, no, na-approve and sinimulang i-implement, nagkakaroon po ng movement ang nurses na from private, nag-a-apply sila sa government or pumupunta sila sa government hospitals that can offer permanent position para dun sa salary grade 15. So nababawasan po lalo yung private institutions.
Pero maraming hospital private Saka sa nangyayari ngayon, ang kinukulang yung mga private hospitals na. Are more nurses willing to go kahit well, sinasabi naman ng mga private hospitals baka nga maging contractual. Pero kapag nag-escalate yung problema natin, kumakalat yung virus, lumalala yung problema, you think medyo dadami yung nurse na who will be willing to work kahit contractual para lang to deal with the emergency, lalo na kung mapapangakuan naman na may vaccination siguro dahil nag-umpisa na yung rollout sa mga health workers.
As far as PNA is concerned po, marami po talagang nurses ang nagme-message sa amin na gusto nilang bumalik sa hospital. No, from BPOs, yung call centers and other fields, no, kung paano at kung ano yung gusto ng hospital sa kanila bago sila tanggapin. Kailangan ba nila ng trainings or another deductive sessions ng teachings para po parang ma-refresh sila with the learning. So yun yung pong gusto namin din na hanapan ng sagot para po makatulong din po kami to disseminate information doon sa mga nurses natin na gustong bumalik sa serbisyo kung ano yung kailangan nilang gawin at kung paano sila magsisimula.
Requirement ba yung vaccination? Kailangan ba ipangako na mabavaccinate sila before they start?
Yes po, we advocate for the welfare of our nurses. So bago po nila i-hire ang ating mga nurses, sana po yung protection, yung safety nila ang unang-una nilang kayang ipangako sa ating mga nurses.
Vaccination muna. Okay.
Cover nyo rin ba yung mga, di ba, iba-ibang level yan? May associate nurse ba yan? Or, di ba, merong registered nurse, of course, yun. Covered nyo rin ba yung mga, miyembro nyo rin ba yung mga associate nurse ba ang tawag doon, di ba? Parang nursing assistant ba? Parang ganun. Oo.
Meron po tayong nursing assistant dito sa Pilipinas pero hindi tayo katulad ng ibang bansa na merong mga LBN. No? Sa atin po nursing aid lang. No? That is under the supervision of nurses. No?
Yun, pero hindi yun ginagamit ngayon sa COVID, yung mga nursing aid. Wala, hindi yun kasama sa hiring or
kasi specialized
hindi
po
sila
ang COVID.
tinatak. Yes. Okay. So,
Specialized po kasi yung pag-aalaga sa COVID kasi medyo ICU po yung pinag-uusapan pagka-COVID cases na severe and
yes.
Na-vaccinate na po kayo?
Ay, hindi pa po kasi ako po ay academician, hindi po ako ng hospitals, no? I worked sa hospital before, pero nasa academe na po kasi ako. Kaya hindi pa po.
Gano'n. Kailangan pala active ka sa hospital.
Okay, Mr. Melbert Reyes, ang Pangulo po.
Tumigil po ako sa hospital noong year 2017.
Okay.
Bakit?
Alright. Ay, bakit?
Bakit?
May pahabol
Pahabol,
siya.
may pahabol. Bakit? Ayun ang tanong. Bakit?
Because,
Bakit po tumigil?
Bakit po ako po umalis sa hospital? Because na-engage po ako na-engage po kasi ako sa Philippine Nurses Association. So yung time
Kala
ko,
ko engaged to
Bro.
be married.
hindi po. Pero if po kailangan, I will be one po na tutulong sa bayan natin. No? I will go back to hospitals if necessary.
Okay, Mr. Melbert Reyes,
Okay.
ang Pangulo ng Philippine Nurses Association. Sir,
Thank
maraming
you
salamat
po.
po for joining us tonight.
Salamat din.
Salamat po.
Salamat.
Thank you.
Okay. Well, our next guest is also going to talk to us about COVID, but we're still waiting for him to go online. But in the meantime, yun nga, ang sinabi ni Mr. Melbert Reyes is that, he acknowledges that there is a problem with regard to the supply of nurses in our hospitals. Yun lang, they're there, it's just that they're not there.
yeah, it's working conditions, it's pay.
Pero no. But I think it's really clear to me, at least, no, that many of these nurses went into nursing as a course in hopes of going abroad.
Yes.
Not really to work here, no? Because now that they're really needed and they're nowhere to be found, it says a lot about their real intent for taking up nursing, I think, no? Yeah, I can't, this is not to blame them, okay? But makikita mo nga na it promised to be a very, lucrative livelihood for them, diba? Going abroad and earning dollars, knowing that especially the US nurses are so highly paid, no? So,
Well, it was a trend for a while. In the same way that just a decade ago or more, diba, caregiving naman was a trend. Parang
Yes,
everybody was
yes.
into that.
Kasi nga, doktor no,
yes, that's right,
That's
nagna-nursing.
Yeah,
no?
dami na yung nawala na doktor. Naging nurse abroad. I can
Okay.
see the mayor na, wala pa ba?
Okay, let's bring in
Yeah.
our next guest for tonight. Of course, it's San Juan City Mayor Francis Zamora. Mayor Zamora, hey, yun, sir, thank you for joining us and welcome back to the
Good
Chief.
evening, Mayor.
Mayor, magaling ka na.
Yes,
Magaling na. Fully
magaling
recovered.
na. Yes, magaling na po.
Mukhang ready to fight
Bakit ka
kayo eh.
naka-uniform na police? Law enforcer ka ngayon.
First of all, good evening, everyone. Of course, Ami, Lucci, Ed, and Robbie. And thank you very much for inviting me once again on your program. It's nice to be back.
Okay, kamusta po? Kamusta ang San Juan? How are you doing? How are you cracking down on violators or how are you restricting movement, for example, to stamp out COVID-19?
Well, first of all, isa ang San Juan sa mga nauna na nagpatupad ng citywide curfew. In fact, from 12 a.m. to 3 a.m. during the holidays, noong March 9, nag-revert back tayo to 10 p.m. to 5 a.m. So isa po
Okay.
tayo sa mga nauna dyan. Next, yung liquor ban natin ay nag-re-implement na po tayo as of 3 nights ago. At lahat naman po ng mga ordinansa natin patungkol sa new normal, such as yung walang face mask, walang face shield, yung social distancing, mass gatherings, lahat naman yan ay in place pa rin. So lahat po ito ay ating ginagawa upang mababangan natin yung bilang ng mga kaso, which napansin natin during the last 2 weeks ay talagang tumaas. In fact, ako nga po I tested positive on March 1. I finished my quarantine last March 15 and I've been back to work physically the past few days. I remained asymptomatic the whole time. I was in good physical condition, but the fact is that positive ako, so I had to quarantine myself for 14 days. I also had to make sure kasi hindi ko rin mahawa yung asawa ko na isang cancer survivor. So nag-decide po kung magpa-confine sa Cardinal Santos Medical Center just to make sure that I do not infect anyone else in my household and in the community.
Mayor, a quick question. Because nung in-announce yung curfew, in the longer curfew, I just took it as a fact and then I really didn't think about it. And then I started seeing this question again and again and again on social media. It sounds very basic, but I think, dami talaga nagtatanong. Ano raw magagawa ng curfew sa COVID-19? I mean, at first, it struck me as, ano ba, parang ano, but then I think about it, I don't really know. And we also had some guests before saying that it might be counterintuitive na ang curfew
Yes.
raw, because it's longer, will force more people to move in a limited in a limited time, particularly yung rush hours sa evening tsaka sa morning. So what exactly is the thinking behind lengthening the curfew?
Okay, ganito yan, ano? Tandaan natin ang normal working hours ng karamihan ay during the day. So understandable na during the day, naghahanap buhay, nagtatrabaho. Ngunit pagdating sa gabi, karamihan po sa atin ay wala namang trabaho during curfew hours. No? What we are trying to avoid is people who have no reason to be on the streets, especially during the evening, they have to remain inside their homes. No? Yung mga nagtatrabaho po sa gabi, sila naman po exempted sa ating curfew. So ano ang objective natin dito? Yung mga tambay, yung mga umiinom sa kalye, yung mga wala naman talagang rason na nasa labas ang kanilang tahanan. And once you are able to limit the people from moving during the evening, nalilimit mo rin yung transmission ng virus. Remember, when people are home, less ang possibility na makapag-transmit sila ng virus. During the day, understandable, nagtatrabaho ating workforce, no? People have business to take care of. But during the evening, karamihan kasi dyan, wala na talagang rason na nasa kalye pa. Yun po ang ating intention. And coupled with a liquor ban, naniniwala ho tayo, ito'y makakatulong sa pagbaba ng mga kaso natin sapagkat kapag nagiinuman, nagkakakwentuhan, nagkasiyahan, no? Minsan nawawala talaga tayo sa disiplina natin. Ang tendency, syempre, pag nagiinuman, walang mask, tapos yung transmission po ay nangyayari na. Lalong-lalo na kung hindi natin alam na tayo positive na, meron tayong kainuman na iba, kakwentuhan. So these are activities which we feel can be dispensed with at this time. Di naman yan importante, no? Di naman yan essential activities. Kaya ho natin ito ginagawa just to lessen the chances of transmission.
So, saan
Ngayon, kamusta na po yung huli dyan? I mean, mataas bang compliance? At pag nahuhuli, ano ba pinapagawa? Pinapag-push up din ba? O pinag-exercise katulad doon sa Maynila? Anong parusa or aral para may maiuwi na aral?
Well, una-una meron tayong penalties na i-impose ho dyan. Ano? So yung liquor ban po natin, that's 3,000 pesos sa first offense, 5,000 pesos sa second and subsequent offenses. Sa ating curfew naman po, 1,000 pesos sa first offense and 5,000 pesos po yan sa second and subsequent offenses. No? We have to impose penalties because if we do not, people will just laugh at us. No? Kaya babaliwalain yung mga ordinansa natin. Kaya dito ho sa San Juan, in fairness, no, sa mga San Juanenyo nakikinig, no, mababa naman yung bilang ng mga nahuhuli dahil sumusunod naman po ang karamihan. Meron pa rin nahuhuli, yes, but not too many. In fact, during the first night of our curfew, only 15 violators were apprehended. They were given tickets and they were asked to pay. Now, if they do not pay, then hindi nila makukuha yung mga ID nila na confiscate. So, at the end of the day, magbabayad din sila. Yung mga walang ID ay dadalhin po sa barangay for proper identification and they will be processed dito sa ating police station. So, in fairness po sa mga San Juanenyo, marami naman ho talagang sumusunod sa ating mga patakaran. At ito nga ho, mula nung ako'y nakalabas mula sa aking quarantine, ako'y nag-iikot sa ating mga barangay, lalong-lalo na sa gabi, at nakikita ko ho malinis sa ating mga kalye. Kung meron man mga violators na very little lang po talaga.
Mayor, ang katapusan talaga ng problema yung vaccination, ano?
That
Sa
is
nakikita nyo, the pace of vaccination, the resources being allocated, nakakuha na kayo as a local government in Metro Manila, priority itong region natin. At tingin nyo, gaano katagal bago kayo matapos ng target ninyo, population to be vaccinated?
actually
Considering what we're seeing now.
yes, we've received around a total of 2,000 vaccines already, 2,000 doses. Combination na ho yan ng Sinovac and AstraZeneca. Kaya lang, Ami, ngayon kasi based on the prioritization list, yung medical frontliners at health workers pa lamang. hindi pa nagpo-proceed dun sa next level, which is yung ating senior citizens and our indigent population. One major factor really is the vaccine supply. Kami ho sa San Juan, we procured 100,000 doses of AstraZeneca. However, hindi pa yan dumarating dito sa aming lungsod. So we are still waiting for the delivery. As of today, wala pang malinaw na petsa talaga kung kailan yan darating. So ang inaasahan natin, yung supply from the national government, which actually is the source of our initial 2,000 doses. Ito ho'y dinivide between Cardinal Santos Medical Center and our San Juan Medical Center. So yan naman ang aming dalawang hospital, our main private hospital and our one and only local government hospital. So ako, naniniwala talaga Ami na ang vaccine ang magiging game changer natin dito. No? In fact, what we are doing now since January 4 is to have our online and manual registration ng ating mga mamamayan na gusto magpabakuna. Ito, if I may share, no? I have my data here with me. So as of March 17, meron na tayong 34,775 registrants ng ating bakuna, and 31,319 are our constituents and 3,456 are our health workers and medical frontliners. So that's already 40% of our target population of 85,400 na bakunahan. No? Yung 85,400, that is derived from our 2015 census, which states that we have 122,000 San Juaneños in our city. So to achieve herd immunity, we need to vaccinate 85,400. Right now, nasa 2,000 pa lang ang ating nababakunahan sapagkat yung pa lang ang supply na dumarating po sa atin.
Anong best case scenario mo? When will you finish with the 85,000?
It will really depend kung gaano kabilis po dumating yung supplies po natin. Yung pinocure po ng San Juan na 100,000 doses, that's already good for 50,000 San Juaneños. We are hoping that in the next, possibly, next 1 or 2 months, sana nga dumating na po talaga itong AstraZeneca. Just for your information, most local government units in Metro Manila procured AstraZeneca using yung mga LGU funds po natin. Kung ano naman ho ang ibibigay din ng national government, of course, magpapasalamat po kami dyan, regardless if it will be Sinovac, AstraZeneca, or any other brand, for as long as meron na siyang emergency use authorization, for as long as FDA approved po siya. Yan naman po ay ating tatanggapin at ibabakuna agad-agad sa ating mga mamamayan.
Mayor, about 2 weeks ago, nabuksan na naman yung usapin na, ang daming contact tracing apps. Maybe we should be unifying all of this. Kamusta na po yung suggestion na yon?
Well, sa totoo lang, mas maganda talaga kung merong unified contact tracing app. But a lot of people kasi merong misconception. Akala nila just because may QR code ay contact tracing app na. No, it doesn't follow. Real contact tracing is really investigative in nature. No? When you say contact tracing, aalamin mo talaga saan nahawa, sino ang close contacts, saan siya pumunta. It's not just signing up through a QR code. In fact, kami ho dito sa San Juan, sa tulong po ng Multisys, sila yung nag-develop ng Stay Safe app. We are about to launch our upgraded contact tracing app through our makabagong San Juan app, which really detects kung ikaw ba ay nag-positive, ikaw ba ay close contact, sino yung mga nakasama mo. No? Required kasi na pag i-declare mo sa DOH ka na ikaw ay nag-positive, no, which you cannot hide because it is a crime to hide the fact that you are positive. No? So lahat yan dapat pumasok sa isang maayos na database at ipoprocess ng iyong City Health Office. So again, it would be ideal talaga na merong isang centralized, uniformed contact tracing app na ginagamit ng lahat ng LGUs. However, yung ibang LGUs kasi may kanya-kanyang nilaunch na rin at ginagamit. So integration would be very important here.
No, we
Mayor,
understand. Go ahead, Luchi.
Go ahead.
Yeah, sorry.
No, well, yeah, go ahead and follow up.
No,
Robbie,
if I follow up, we understand what you're saying, no? That there are more moving parts here. It's not just having one app or one QR code. But I mean, kasi I think experience naman lahat ng tao ngayon. If they did a mental exercise right now, I don't know how many QR codes I have associated with me across the different cities and commercial establishments that I've registered in. Parang we understand that you're saying that it's not just about having one QR code, but it seems logical when you say that, yeah, but why can't I just have one QR code and then let all the other apps be able to recognize that QR code?
Yeah, wala kasing nagiging integration pa eh. And remember, each LGU kasi may kanya-kanyang autonomy, may kanya-kanya silang karapatan naman na mag-implement ng kanilang mga patakaran. So that is something that we can really explore, and I believe that it would help if all the contact tracing apps of all the LGUs will be integrated. I'm just not sure kung ano yung parang technical backbone na kakalanganin para dyan. But ideally, dapat talaga nag-uusap-usap at nagkakaintindihan yung iba't ibang mga contact tracing apps ng LGUs sa Metro Manila.
Mayor, apart from the curfew and the liquor ban, how are you finding other ways to impose sabi nga nila, a stricter GCQ? For example, limiting mass gatherings again, and ito sabi ni Dr. Dance in one interview. He also lays the blame on many of the restaurants who insist on indoor dining in a closed space instead of bringing it outside na parang al fresco style, para nga naman nasusunod daw yung apat-dapat na protocol. Are you going to be doing that, especially in San Juan, where there is a sprawling mall there, in Shoppersville and Chopsville and Green Hills?
Okay. Lucina, first of all, allow me to say na what we are experiencing now in San Juan, we've experienced before. No? Yung Metro Manila, dumaan na rito. In fact, it was a lot worse last year. Around August last year, yun yung naalala kong peak ng bilang ng mga kaso natin. So, ibig sabihin, naranasan na natin to dati at nagawa naman nating ibaba din dati. That means what we did before indeed worked. No? Ano man ang naging dahilan ba tumaas ulit, hindi natin talaga masabi. Possibly yung variants, malaking factor talaga based on what DOH and Opta Research tells us. No? Mas infectious kasi yung mga bagong variants natin. But going back, yung minimum health standards talaga, kung susundin niya ng lahat, makakatulong. Because it was something that we had to implement firmly before. And in fact, during last February, nahila namin down to just 30 cases dito sa San Juan. So itong last 2 weeks talaga tumaas yung buong Metro Manila. Dumaan yung Pasko, Luci, na hindi naman tayo talaga nag-increase. No? Halos 5 to 10% increase lang ang naranasan natin after the holidays because people were really following the health and safety protocols. So I guess coming into 1 year ng COVID, hindi mo rin talaga maalis yung fact na mentally, psychologically, possibly, yung tao pagod na rin, yung mental fatigue, and sometimes causes us to lose some discipline in terms of ourselves, yung pagsuot ng mask, pagsuot ng shield. You would see people naka-mask pero nakababa dito, yung shield nasa ulo nila. I mean, it has to be a mindset. Yung dito naman sa binabanggit nyo about alfresco and yung indoor areas. Ako, if I may share, very OC ako sa sarili ko. So I always wear my mask, I observe physical distancing, and yet nag-positive ako. Thankful na asymptomatic, thankful na wala akong naramdaman kahit ano. But nag-positive ako. And looking back, something that I may have disregarded before or not have given too much attention to, yung ventilation and air circulation. Kaya nga, ako ho ngayon, mula nung bumalik ako sa opisina, when I have to meet people, especially pag more than 1, 2, or 3, I meet them now dun sa roof deck ng City Hall.
Yes,
sa open air.
air.
Yes, because walang mawawala sa'yo kung mag-ingat ka. Di ba, sometimes akala natin kahit 3-4 lang tayo sa isang kwarto kumakain, no? But the ventilation, if it is not well ventilated, no, yung circulation ng hangin can cause infection. Eh. So
Right.
this is something that has not been given too much attention.
Yeah. Do you think you have room to enforce something like that in, among the restaurant owners or operators in your city?
We have to assess, no? Kasi remember, hindi lahat merong access to alfresco areas. Swerte yung mga restaurants whose locations are within yung perimeter ng mall, no? Kasi yon meron talaga alfresco. However, yung loob ng mall, and remember, it's not just the restaurants, your offices, your TV studio, di ba? Even our own homes, even hotels, malls, yeah, movie theaters, any air-conditioned area can potentially be a source of infection. So we really will have to restudy all of this and see how ventilation can be improved so as not to allow the virus to spread to other people.
Okay.
Mayor, may proposal ang Okta, one of the members, na double Holy Week, total lockdown. Ayaw mo yun.
Okay.
Just to contain.
I-extend daw ng 1 week yung Holy Week.
Double Holy Week. 2 weeks para lang ma-contain daw, para mabilis na mabilis, at para daw mabilis na mag-reopen. Does that make sense to you?
Well, itong ginagawa natin ngayon, actually our target really is from March 15 to March 31. That's a period of about 16 days. No? Ito yung hinahabol natin, no? Na panahon or window na makontrol. If not nga, may baba natin yung mga kaso. Because if we will have strict implementation in the next 2 weeks to 16 days, no? We will eventually see the data by the end of the month. And we are hoping that since we are having more or less a uniform implementation of all health and safety protocols in Metro Manila, at saka heightened naman yung monitoring and execution ng ating mga law enforcers, umaasa tayo na ma-halt na itong increase, no, sa active cases. And by end of the month, we can reassess. Ang Metro Manila Council, kami po yung nagpupulong 3, 4, 5 times a week. No? Sometimes may biglaan kaming meeting with the IATF, with DOH, with the Okta. So kami naman po on standby anytime. No? So on a need basis siguro, no, malalaman natin kung ano ba yung magiging sitwasyon natin by March 31. But remember, one tricky thing is after March 31, papasok naman yung Holy Week. Diba? So yan ang medyo tricky dyan sa ating time frame. Because remember, come Holy Week, a lot of people may go home to the provinces, diba? Magkakaroon ng movement yan. And
lockdown daw.
that will be critical. No? So, hindi ko muna masasagot yung proposal na yan sa ngayon. I would rather see muna anong effect nitong heightened implementation natin hanggang sa katapusan ng buwan. And yung 2-week period kasi, if you will follow yung 2-week period din ng virus, once makokontrol mo kasi yung movement ng tao, malilimit mo yung transmission, we should see some effects in terms of the numbers by end of the month.
Okay. San Juan Mayor Francis Zamora, sir, maraming salamat po for joining us tonight.
Thank you,
Okay.
Mayor.
Maraming salamat po.
Thank you very much, and it's nice to see all of you again.
Thank you, sir.
Nice to see you well.
Thank you. Thank you.
We will just go into a break, so please stay with us.
Welcome back, the Chiefs here on One News. Now joining us for the final stage of our conversation, Atty. Domingo Egon Cayosa, President of the Integrated Bar of the Philippines. Attorney, welcome once again to the Chiefs.
Good evening, sir.
Good evening,
Pwede
attorney.
po.
Good evening, everyone, and good evening to our televiewers.
Attorney, of course, we invited you because a lot of very troubling things. We see a judge getting red tagged. Last week, we saw, according to the PNP, an overzealous junior officer asking for a list of lawyers who are representing red tagged suspects. And then now the numbers being reported by Flag since 2016, 61 lawyers killed under the Duterte administration. We understand you met with the PNP recently. I'm just curious, when you meet with the PNP, when the lawyers essentially speak with another institution, in this case the police, what is the premise of your conversation? Is the premise that you are in position to do something about this, and on the other side of that the police were actually somehow responsible or are part of, should hold some responsibility for what's going on?
Well, the main premise is that we are all professionals, and there's commonality between the legal profession and the police officers because we are supposed to be sentinels of the rule of law. They are supposed to be the law enforcers. So there's commonality. Secondly, we would like to believe that the leaders of these organizations have a keen sense of responsibility, and that it is the part of the responsibility of every institution to cleanse the ranks and to right the wrong that might be done by some elements or personalities within the ranks. That's the main premise why we are talking with the PNP. Also because early last year, we managed to have a memorandum of agreement with PNP that was already in reaction to the continued killing of lawyers. So beyond issuing condemnation public statements, our leadership, we thought it would be much better if we start talking and working with the PNP leadership. And it has shown result. No? We will continue to call out irregularities, crimes committed by anyone else, including our police forces, abuses. We will continue. But at the same time, we also explore communication lines, develop communication lines, so that we can proactively work on things that is of mutual interest and benefit to the two institutions.
Yes, but Attorney, I mean, speaking of those communication lines, as you said, the concern about the killings had been going on for years. I'm just curious, yung pong dialogue nyo with the police, I think that was yesterday. Was that planned long ago? Was that scheduled long ago? Or is it fair to say that the recent developments have raised the level of alarm and urgency?
Well, the agreement was a long time ago, and the lines of communication have been opened, even with the former chiefs of the PNP. And it has produced good results so far. The more recent killings of lawyers, because we were able to quickly exchange information and work at the national and local levels, compared to the other previous killings, even in previous administrations, mas mabilis ito. In less than a month, the assailants were identified, pursued, arrested, and charged in court. So medyo mas mabilis ngayon. So nakikita natin, there is wisdom and practical advantage or good when we at least have communication lines. But the meeting yesterday was precipitated by that act of this lieutenant in Calbayog writing this letter to the clerk of court, asking for the names of lawyers representing or helping what they call CTGs, communist terrorist groups, or the progressive elements or groups in our society. So we found that very alarming, and we raised it as an issue. We brought it quickly to the attention of the authorities, the higher ups, and we are also very thankful. We told them, look into this because we cannot let this pass because it alarms and concerns not only the court employees and the judges, but every Filipino lawyer. And they responded
Yes, that's
the
also,
following day.
yes.
Well,
Yeah,
Atty.
so yan na nga yung red tagging din, ano? And today, the latest one, of course, was si Judge Monique Sumbing na, well, we don't know really, but nangyari na nga yung tarpaulin, kinongratulate siya dahil sa pagpapalaya niya kay Lady Ann Salem, and so on and so forth. What do you think is happening here? Are you getting a sense that this is the government doing this? Or is this one of those, alam niyo na, parang either side provocating and bringing a discussion into to a point where it's going to be heated and there's going to be finger pointing, and at the end of the day it's going to be the government again that will be blamed? Or is it the other way around? I don't know. What do you make of it?
Well, there are many specific acts or incidents of what may be considered in a broader sense red tagging. Even the effort of this lieutenant to ask the court for names of lawyers could be put in that context. And that is a fact. He wrote the letter, it was received, and it was the pushback, the vigorous pushback and the prompt pushback that really unraveled the whole thing. And we are also very thankful that the top leadership immediately disowned, not only disowned it, but they punished the guy. And they are holding them responsible. What we're asking now is deeper investigation. Then the more recent, we call that terror tarpaulin against this judge. That was more recent. It was brought to our attention yesterday in the morning. We brought it up in the meeting yesterday. A few hours later with the top brass of the PNP, and they're looking into it. But the IBP, through our Pasig Rizal chapter, did the initiative of coordinating with this local authorities, MMDA and Mandaluyong, and they had it taken down quickly. So, hindi na kami naghintay. Yung IBP, hindi na kami naghintay ng investigation because it is by itself very troublesome, and we don't do that to judges. So, judges, remember, are members of IBP. So I think it is right for us, and we commend our Pasig chapter. We fully support them, and that this will be our instruction. These kinds of improprieties, I may say, at the very least, should be addressed quite promptly and vigorously. Ganun na ang aming ginawa. It was taken, and thank you all to the LGUs, and they took it down.
Attorney, are you also talking to the AFP? Kasi ang talagang in charge ng yung counter-terrorism is the NTF LCAP, National Task Force yun eh. They're mostly military. Are you also planning, is the IBP planning to coordinate with the NTF LCAP? Unang-una sinabi na nila, hindi nila papalitan si General Parnade. And sila talaga yung inaakusahan, of course, denying ng red tagging. Are you also planning to meet with them in earnest to propose kung paano maaayos itong mga problema?
Well, we don't have any formal relationship or communication lines with LTAP. If you notice, LTAP is much broader than the AFP. So AFP is a key component of the LTAP, diba? So we don't have that. The reality is we have also a similar MOA with the AFP. And in some instances, we also exchange information with them to explain and clarify some of the not accurate information that they have. So in some instances, we were also able to address the security concerns of lawyers by working with them. In some instances also, families of lawyers suspect either the police, the government, or the military involved in, possibly involved in the killing of their loved ones, we respect that. So we have a similar MOA with them. As a matter of fact, we have a program where our free legal aid program system helps educate our men in uniform on basic human rights,
Yes, sir.
procedural due process, and we do that. Our director for human rights, the national director for human rights of IBP, who happens to be the director of the Ateneo Human Rights Center, is the one lecturing before the officers of the Marine Corps, because it's a model system where
Yes, sir.
the executive officer, the second in command, is in charge of the human rights program of the Marine Corps. So
Yes, sir.
we have
Sir.
that continuing program.
So, sir, we'd like to think that the judge would not be affected in any of our future decisions by something like this. But of course, I mean, realistically and pragmatically, do you think this would have any effect on other judges, other members of the court who would have to rule over similar things? What do you think was the intention?
Well, though we hope, and theoretically a judge will have to do the right thing regardless of
Yes,
these
sir.
extraneous forces, influences, the reality and the truth is judges and lawyers are human beings. They're scared. They're threatened. They fear for their lives. Because we've seen enough of killings, no? By mere say-so, people act, we don't know. And there's so much impunity that even the judges fear that once your name is there, social media, in this case, a very public place, and it's all over social media also, you feel threatened. You feel violated, not only for yourself, but including your family. And
Well, that's
you
my
cannot-
question.
Yeah, but-
Who's scaring who?
Exactly.
Who's scaring who?
Exactly.
That's my question. No? Is it the government scaring you, or is it the other side scaring you so that the government is blamed for it? Who's scaring who?
Well,
Intrigahan to, obviously. No?
Sir, sa TARP kasi nakalagay,
Definitely.
sir, sa TARP nakalagay sa TARP mula sa CPP, NP, NDF. Yun ang nakalagay sa TARP.
Yes,
Do
yes,
you believe?
yes.
Do you believe that that really was the source of this, or do you think it was something else or someone else?
Well, we cannot establish the facts, no?
Yes,
As
sir.
a trained
Yes, sir.
lawyer, we cannot conclude. But, you know, it is preposterous to think and they would do that, no? So, whoever did that, did it with malice or with a sick mind, no? You don't gain anything good by doing that. You definitely scare, not only di sa kanya, yung nag-a-apply ng
Yes, sir.
warrants eh. So they're now in a dilemma, no? If they grant the warrant, the other side, attacks them. If they don't grant the warrant, the other side attacks or suspects them. So let's give our magistrates the freedom to decide well without fear, harassment, or retribution, or harm for that matter. So definitely naapektuhan sila. And that's what we're trying to prevent by taking immediate and decisive action. We want our judges to be able to do their jobs fairly without worrying about their security, without the undue influence, the publicity, the politics, the ideology. We need really to rally behind these judges because otherwise, if we fail, then only the tough guys, those who are willing to use violence, and the criminals will rule our justice system.
Yes, sir. Okay. IBB President Egon Cayosa. Sir, maraming salamat po for joining us tonight at ingat po kayo.
Thank you, Atty.
Maraming salamat po.
Maraming salamat. Good evening po.
Good evening po. And that'll be all for this midweek edition of the Chiefs. We hope what was discussed here will keep the conversation going. Now, before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Mandaluyong.
I'm Mami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
And I'm Robbie Alampay. We are One News.